Welcome to the Neuromodulation Podcast, presented to you by the International Neuromodulation Society. Dive into the forefront of today's emerging neuromodulation techniques, insights, and ethical and clinical applications. Subscribe now to join the multidisciplinary collaboration of medical care providers, scientists, and engineers who are part of the global conversation that's shaping the future of healthcare. Welcome to today's episode of the Neuromodulation Podcast. I'm your host, Mandi Soleil, and I'm delighted to be joined by two guests today. We've got Professor Erkan Kurt, as well as Linda Kollenburg from Radboud University in the Netherlands. Welcome to the show today.
Thank you so much.
Thank you for having us.
So I want to kick things off by introducing the fact that you are a mentor and a mentee, though in my time of knowing both of you, we've joked a lot about you being the mentor and you being the mentee. So I'm curious, can you share a bit about, either of you, would you share about your how you got acquainted with one another?
Maybe you can tell the story how it started.
Yes, so it's kind of a funny story, which started, I think, about 2 years ago. So I enrolled myself for a class which was called neurosurgery at my university, and he was one of the teachers there. So the more classes he gave, the more I got fascinated by the field of neuroscience. Like, he challenged me with good questions that made me, think about all of that. And I just became more and more fascinated when, the more classes he gave, the more fascinated I got. Mm-hmm. So then all of a sudden I started asking more and more questions because I was really interested about it. And at a regular day, I was just doing my homework and I got an email, and it was from Erkan, and he wrote me, "Were you the one on the first row on the right side during my last class?" I didn't know what to expect, so I was kind of nervous, so I replied, yes, it was me. And then he asked me if I wanted to come by his office to chat with him. So, me as a medical student, I was quite nervous, to be honest. And my knees were like shaking, and I walked to his office, kind of scared. And then it wasn't as scary as I thought. You were kind of nice, actually.
Just kind of.
So, no, but really, we had a great conversation, and it started with one project on occipital nerve stimulation. We wrote an article together about that. And from there, it kind of progressed to us working on different projects. So now we're also working on cingulotomy, for example, which is also a procedure in neurosurgery for central pain, as well as occipital nerve stimulation for cluster headache. So those are the things we are working on now. So it continued from there.
Actually, it started then, but when I think back, you were the only one who asked those intelligent questions. And that triggered me as a mentor, because I'm always looking to good students, medical students, who can do research in our field, in functional neurosurgery. So I was surprised the way you asked all the questions. So I was interested in you as a person, and I thought maybe for the future you could be very, very useful in the field. And that's the way how it started, our mentor-student relationship. Maybe you don't remember that, but you were the one who asked all those questions. The other ones were more quiet. There were about 30 students in the room. You were the only one who asked all those. And some questions I even didn't have an answer on that, so I had to think about that.
Yeah, but it's you who challenged me.
Afterwards,
not everyone.
Yes. Yeah. So we got in a nice system with feedbacks. You asked, I asked, you answered, I answered. And that was the beginning, I think. And then in 1 week, you wrote that very nice paper, because I asked you, can you do this? Because I'm interested in the anatomy of the occipital field. In 1 week, you finished that paper. Can you remember?
It was so
That was
funny.
excellent, really.
I went to his office, and he was 1 week before, was the second meeting, I think. He said, let's write a review on this topic, occipital nerve stimulation. And I was like, yeah, that's interesting. I never heard about the whole occipital nerve stimulation topic because, I was just a first year medical student. I didn't know. So then 1 week after, we met up again to discuss about what should be in the paper, but I already wrote the paper without him knowing, because I just wanted to make a good impression. So
Surprise me.
Yeah, so like I wrote the paper.
Yeah.
I had it like beneath my notebook, and he was saying, this should be in it, this should be highlighted. But I was studying week like day and night to be able to understand what occipital nerve stimulation was, how to write a review, and I just some way managed to make it work. I gave him the paper. Of course, like it changed afterwards, but that was like a nice beginning of the papers that we wrote since.
That's how it started then.
Yes.
Yeah, exactly.
Is this paper published?
Yes, it's actually, I presented it at I won the abstract award with it. It was my first paper, yes. Yeah. So it was called the Untold Story of Occipital Nerve Stimulation for Patients with Cluster Headache, with focus on the surgical technique and clinical efficacy. So it's kind of, it was our first paper. So it's very special. It was presented
during the European chapter meeting in Hamburg.
One thing I recall you mentioning to me, Linda, is that you weren't actually interested in neuromodulation or neurosurgery at all. What were you looking at prior?
I wanted to be a cardiothoracic surgeon for most of my life. Because we're all very young. How are we supposed to know what to do with the rest of our lives when we, just entered life, world, So I wanted to be a cardiothoracic surgeon since I was 12. And to be honest with you, Erkan, there was not really a cardiothoracic topic for me to follow, but neurosurgery, surgery is surgery. So that was the closest one to me. And I don't know how, but you got me so fascinated. And I never really thought about neuroscience before.
Yeah.
Never, it never really caught my eye. But when you were talking, like your passion, the way you explain things, your motivation, the energy, it has been, it's just, I cannot describe how you motivated me.
Thank you so much. Yeah.
Yeah, it's him. He fascinates me, he inspires me, and he's the reason why I would like to become a neurosurgeon now.
I think that's important. I always do it with passion. I teach, I do research, of course I do my patient care, treat my patients, but still you need feedback from students. I can be passionate in a room with 100 people. If there's nobody interested in it and is passionate too, then we cannot develop a mentor-student relation and go on and develop things and new innovative things to do research in. So it's important to have this feedback as well.
Should go both ways.
It should go both ways, right.
And I think oftentimes identifying how to build a mentor-mentee relationship can be challenging. How, in the past, have you, Dr. Kurt, reached out to students in this way? I mean, you've brought her into this field and she's already contributed incredible things only as a medical student. I can't even imagine where your career is going to go. It's going to be amazing, that's for certain. But do you generally identify students that you see as sort of star pupils in your class, or how have you gone about building mentor-mentee relationships in the past?
Well, that's a good question. It's very difficult to find a good student nowadays. If I go back to the 90s, it was different. At those times, it was the professor, the doctor, who found the student and sent the student abroad to another university, another school, to learn things and come back to introduce those techniques into their own clinic. But nowadays, I think things are changing. Some students are not that motivated anymore like they were 20, 30 years ago. So it's hard to find a very good, dedicated student. Of course, anyone wants to finish his medical school, but most of the people want to do the minimum thing to achieve that goal. And it's hard to find really interested, dedicated people. And in the new times, nowadays, I think it goes both ways. So students who are motivated, students are trying to find a department or a mentor in which they can work, in which they can do research in. So the field is changing. In the past, it was a mentor who found the student. And nowadays, it's a cooperation, both ways. And the good students, find their mentor. I think the field is changing. And I, of course, when I'm teaching, I open my eyes, I look in the room, and I can see, I think in 1 minute, who's more motivated or not. To be honest, some people are watching on their iPhone while I'm talking. Some people are looking around. Some people are writing things down and making pictures. Then you can see who is motivated or not. It's important to see that. And when they approach me, then I'm interested in them too. Because I can be passionate, enthusiastic, but I still need someone who is passionate too to get a good relationship. Not everyone can become a star, of course.
And Linda, where does all of this motivation come from that Dr. Kurtz recognized in you?
No, I think just studying in general is something that's really part of who I am. And it's just, I got so passionate. It's something when I'm studying or now when I'm doing research, I can just forget about everything else. And just the only thing that matters is me writing behind my computer. And the things like, for example, going to congresses, networking. He takes me to meetings. He explains to me how to write, how to present. And it's just, has been just incredibly amazing. And I think he motivates me because if you would be behind the screen just writing articles, that's fascinating, of course. But having someone near you that helps you with, takes that step with you along the way, like I think he is just a big part of the passion I have. He inspires me, motivates me. When I'm stuck, he gives me the advice I need. So just to have someone by your side.
My goal is that you become successful in this field. Of course, you have to finish your medical school. Then you have to get into your training program to become a neurosurgeon. And in that meantime, you can develop your skills in the field of functional neurosurgery, especially neuromodulation maybe. My goal is to get you successful. It will take time. But it's not only the knowledge that I transfer to you. There are more things. For example, as you mentioned, just make a presentation on PowerPoint is not that easy. So many people have so much text on a slide, for example. Then you can hear people in the audience, they start talking with each other because you cannot read it. There's so much text. So I correct you and say, please put some less text on it. Make the figures be a bit larger so people can see it. There's also a kind of training that you develop. And also in the Congress, I can remember it was 1993, I think. It was the first pain Congress I went to, was in Tenerife. And my mentor took me with him to go to the Congress and have a talk. I was very nervous at the moment. And I entered the Congress Center. I knew nobody. He knew everyone. So he was talking with all the people and I stood there all by myself, all alone. I was thinking, what should I do? Because I know nobody. And at that moment he said, well, if you don't know what to do with yourself, go to a stand, talk with a medical company, meet people at least, ask them what is that kind of device, how does it work? So at least you can get in a talk with people and then you will learn by yourself to meet other people and you're in the field. Some tips and tricks that are important for you as a starter to get self-confident in this field.
I think, to add to that, it's just very important in general to know that a mentor is not just there to, teach you just medical facts, because with that we can also, watch a lecture online, but it's really, it's having a mentor is so much more than that. It's just, for example, as Erkan already said, the presentations. Just to mention an example, I needed to give a presentation a few days ago and we were looking to see if the room was empty. And he said, Linda, just go up there and I will sit here. He was the only one there. And he made me practice over and over and over again to make sure.
It was perfect.
Until it was as good as it could get. And he was thinking about all the possible questions I could get. And he was helping me with how to answer it. So it's really... He learns me how, not only medical things, but also how to present at the congresses, how I need to interact with others. He really introduces me to the people in the field, which makes it so much easier to learn and to get to know others as well. So I think it's not only good for my professional development, having you as a mentor, but also for my personal development as well.
Social attitude, I would say. Yeah, it's important. how to stand there,
Exactly.
look into the audience, look at the people. Yeah, be positive. Yeah, important things.
And I'm curious, this is a bit of a rare dynamic from what I've observed in the community. I haven't seen many mentorship pairs that are bringing someone into the neuromodulation space in medical school. Why do you think that's valuable, Dr. Kurt?
I think the earlier you start, the better you can be later. That's my opinion. And if someone has talent, that's also important, because you have to be interested, you have to be dedicated, you have to be willing to work. And if you have talent, then I think it's best to be involved as early as possible, so you can make a really nice flight into the field. If you start later, of course, it's also good, but the earlier you start, the more experience you have, the larger your network will become earlier. You can get into committees, meet people, and maybe also develop later things, being innovative. That's my opinion. Yeah.
Well said. Will you tell me a little bit about the research that you've done together?
Can I pass that question to you?
Yes, sure. So just add to me if I forget something, as you're still the mentor. I'm just the mentee now.
I'm responsible.
You're still responsible for all the mistakes I might make during this podcast. You'll be the one held responsible.
I correct you, don't worry.
That's the advantage of being a mentee. So, as we already talked about doing the occipital nerve stimulation review for cluster headache, we've then we wrote an article, also a review on, a broader perspective of occipital nerve stimulation, which is covering, literature from occipital nerve stimulation, which has been performed in different types of headache disorders. For example, also chronic migraine.
4 decades, you mean?
Yes. So the paper is called 4 Decades of Occipital Nerve Stimulation.
Together with the colleagues from the United States.
Exactly.
Yeah.
So that, and now we recently also wrote a paper which is called Occipital Nerve Stimulation, Lessons to Learn from the Voltage Tuners, which just describes a unique phenomenon, which can be seen in patients with occipital nerve stimulation suffering chronic cluster headache. Yeah, we also did research on cingulotomy, for example.
I think this is the second large part that you're taking into.
Yes.
It's the destructive surgeries. Actually, we do in our department, you have the neuromodulation unit for brain modulation, like motor cortex stimulation, spinal cord stimulation, peripheral nerve stimulation. Although it's not reimbursed, we have to ask the insurance companies to cover that, of course. And then we have the field of the destructive surgeries, like burning in the brain, like cingulotomy, the dorsal zone lesioning, the nephrectomies. So the field is large, but you are involved in 2 fields at the moment. And you're doing really a nice job in it. With nice papers upcoming now. Yeah.
But together, without you, no papers, right? So I think it's just the both of us making it work.
Right.
It's not just me, just
but you're
you.
Dedicated. That makes it nice.
Yeah, but you make me dedicated.
Yeah, okay.
Without a dedicated mentor, no dedicated mentee, right?
Yeah.
Team effort.
Team effort, yes.
Can you explain what occipital nerve stimulation is?
This time, no. This time, I'll pass it to you. I'm just a medical student.
It's a way of peripheral nerve stimulation in which we put 2 electrodes on the occipital nerve. So it's called occipital nerve stimulation. And by stimulating occipital nerve, we can achieve effects and treat patients, for example, suffering from cluster headache, intractable cluster headache. If you look at the technique, it's a simple technique, but with major, great effects on the quality of life of patients.
Can you help me understand how you incorporate a mentee in your process? Does she ever come into the theater with you? Are you just working on research papers together? What does this relationship look like when it comes to research?
Well, of course, I have more students, and I make appointments with them every month. I try to. And some cancel those appointments at the last moment. So I have those students as well. And then it's again a feedback that I need as well from them. So when I cancel their appointment, then I skip that project for that moment. I wait until they get in touch with me again. And with those who are really dedicated, they contact me frequently. Every week they send me a message by mail so I can answer them back. But monthly I see them and I look to their capacity. What are they able to do? So if they write very well, I can ask them to write a paper. Otherwise, if they are interested but not that capable of writing, I can ask them to look at the data, for example, to help me with analyzing the data so I can write a paper. So the mentor-student relationship a bit depends on the capacity of the student itself.
And how do you split up the writing process?
Well, I must admit, Linda is really that good. She's able to write by herself, I think for 80-90%.
Wow.
Yeah, so I'm only correcting the final touch. I correct, is everything correct with references? Did you not forget nothing in your search? How does the layout look like? Of course, there are more authors who are responsible for the content of the paper. So the more people involved, you can ask them as well for their input. But you are that good, so I don't need to correct that much, to be honest. And with others, I have to correct more. So in the beginning, I will get in a process with them by mail. And then after a couple of months, manuscript is finished, and we send it to the other ones who are also co-author to get their input to have a nice paper. But you write that quickly, so it makes it more easy for me.
Yeah. I think, how it usually goes is we're just, grabbing a cup of coffee and we're just talking, brainstorming.
Yeah.
He has some amazing ideas for research. So that's all on you, I have to be honest. So we're just discussing with a piece of paper, a whiteboard, talking about important topics, interesting things for future research. We then just start discussing. So what can we write a paper about? What should be included in the paper? What as a neurosurgeon do you see in the field that you think should be discussed? So we kind of discussed the content of the paper to make sure I understand what should be discussed, for example, or what should be concluded from the article. And with that being discussed together, I start writing. But before that, we really discussed
You
the
have
content
received all the
together.
input
Yes,
already from
together.
me.
Yes,
Yeah.
and I make an article from that, which will be corrected later. I think, yes, that's how it
But some
goes.
students need more attention, need more guidance. That's okay. The important thing is the final output, the paper itself. And then sometimes it takes 2 months and sometimes it takes 6 months. That's not important. Yeah.
And it's also that I think as a mentor and a mentee, you grow together. So maybe the first paper you write, you need to correct a bit more. But the more you get to know the style of one another of writing, it gets easier and you have to correct less as a mentor. So you also, you can grow together.
I think
in
it's
that.
important to mention that thing. For me, it's important to get feedback from you too, because sometimes I forget papers as well. And then you make me notify that. And you pointed to that article. And I say, I didn't read that one. So that keeps me sharp as well. And that's, I think, important in the mentor-student relation, to keep each other sharp so we can come further together in the field of research.
I think what a lot of people maybe tend to forget about is that you learn both ways. So it's not just the mentee learning.
Right.
I think you learn both ways. So it's also the mentor learning from the mentee and the mentee learning from the mentor.
That's correct. Yeah.
So for medical students who are perhaps interested in participating in research, it sounds like you've got pretty exceptional writing skills. How did you develop those? Or are you just a natural writer?
Well, I have to be honest. I did biomedical sciences before. I did that for 3 years. So the theoretical part. That's in our country called the bachelor. And biomedical sciences focuses on doing medical research.
Okay.
So there I did have some classes on how you should do writing. But I do think it's also important, that you can have all the theoretical information on writing, but you need to really practice. So when I was in class with my previous studies, biomedical sciences, when we needed to write articles, I was really making sure everything was as good as it could get, where others, stopped or wrote half a paper because that was the assignment. Mm-hmm. I was devoted to writing the full paper, and I was planning extra meetings with the teachers there to make sure that it was as good as it could get. Not because it was the assignment, but I wanted to learn it for myself. To really think, being involved, reading articles from other authors, but also dare to challenge yourself, just to write one by yourself, to show it to a scientist or a doctor. It's just the motivation that made me read more and write more and practice more. But also, of course, my background in biomedical sciences helped with that. And of course, the amazing guidance that you've given me, since we met, basically. Yes.
Actually, there are courses on the universities to how to write a manuscript, how to write in good English a manuscript. So advice could be, of course, to follow those courses if you want to get further in the field, if you are dedicated or not. Yeah. And many students don't know those things. So they are very brave, sitting in their classes, following their normal list. And after the theoretical part, after 3 years of studying, they think, what do I like? What should I become later? A plastic surgeon or a neurosurgeon or a general practitioner. And then they start actually their career and still unknowing how to behave, how to get into that field that they like.
Something that I'm hearing from you, Linda, is commitment to excellence. Do you say that's fair?
Yes, I think that's fair.
Where does that come from for you?
You know, I've been through quite a lot. I felt quite lonely through most of my life. So for me, studying, got something like a coping mechanism. It really made me forget about everything. So it was something that was always stable, something that I could always feel like I could express myself. So, it started in high school, just me, being very motivated to do my math or, my Dutch language classes or my French classes. And then because I just had one goal in mind, is that I wanted to become a doctor. I'm sorry, Erkan, but not a neurosurgeon, but a cardiothoracic surgeon back then. So I think one that I felt quite isolated and lonely, and that it was a coping mechanism for me, which has now become my biggest passion. But also that, I had an ambition. There was a goal that I was working towards, which was becoming a doctor. And I think it makes it much more easy to, also work hard for things. For example, high school, you always have classes that you don't like as much, but it gets you through that. So, and since I met you, the mentor also has played a major role in the motivation. So, when I got my first paper accepted, the passion just grew. And the moment he takes me to these meetings, I get super excited. And, the passion just explodes. It's crazy. Nice. So it just keeps growing. But it started from a place where I felt quite lonely. Yes.
Thanks for sharing that. Either of you can answer this. I'm curious what you would say has been the most unexpected part of this mentor-mentee relationship that's come up for you.
Well, for me, it would be that he's not just there, for the medical part and the scientific part, but he's also there for me when I'm struggling personally with something. I can always give him a call when something is up, regardless. So for me, that was the most surprising part, because you kind of sign up for being a mentor in the scientific field or the medical field. For me, it was most surprising that he was also willing to be there when I had my own share of struggles. Yes. So that's, for me, has been, greatly amazing, but also surprising, because I didn't really expect it. You didn't have to also. Yeah,
it's nice to you. Thank you, Linda. Yeah. For me, the thing is, most important thing is you're so positive. You work so hard and you're so dedicated, and that makes me positive too. And I thank you for that, because I am very busy operating, doing outpatient, seeing outpatient in our ward. So I'm teaching, I'm a teacher too. And in the field of research, I need people like you. So I'm thankful for that, because together we have an output. We can do research in the different fields. So that's the win-win situation for me. Yeah.
But was it something you didn't expect before that was really surprising?
Of course, if you look to my curriculum vitae, I have many papers. I'm already 30 years in the field. But on most papers, I have to work by myself very hard. And of course, I had some students in the past, also good students. But for the moment now, you're important. And I have more students who are really good at the moment in our department. But I think it's a win-win situation. So I can do other things I have now more time to do other things or to develop other new research topics in our ward together with my colleagues of the functional surgery. So it gives me time. Yeah.
What do you think your responsibility is as a mentor in terms of how you sort of foster opportunities for your mentees?
Well, that's an important question because I feel the responsibility that she becomes successful. Otherwise, I might have the feeling that I failed. I learned her all the tips and tricks of neuromodulation, how to write, and if she doesn't achieve her goals, I know what her goals are, what she wants to achieve, then I might be feeling that I failed. So it depends on what a student wants to achieve. I talk with them. It's important to mention. I talk with them. How many time do you have? What are your other hobbies? How much time do you want to spend on in your research field? And depending on that, I make a plan for them. I give them the chance to develop. And if they take that chance, I'm happy. And I feel responsible to, at the end, because you have a way to go together. At the end, when they achieve their goals, I'm happy that they have achieved that goal. And when they are not achieving that end final goal, then I think by myself, did I fail or did they fail maybe? Because they were not that motivated and dedicated as I expected that they would be. Then, of course, I have to look back to myself. Where did it go wrong and what can I do the next time better as a mentor? I learned that from that process as well. It's important to mention.
Wow, so you consider your mentee's success a reflection of your success as well?
Of course, yes. It feels like that. When they are successful, I'm successful too because I'm happy then. And I did a good job for them.
And I think you make an exceptional point with respect to expectation setting, right? We want to be able to recognize people for who they are and not what we think they are.
Everyone is different. Yeah, I agree with that. You have to speak with them. You have to speak with the students. What do you want to achieve? And again, how much time do you want to spend? Because some people want to spend more time on sport or other hobbies. That's okay. That doesn't matter. If you have 1 hour every week on doing research, of course, there's not that much time to achieve great goals. You have to be honest on that. I have to explain this to them. They will understand that they don't know how it works. If you're a student, you don't know how it works in a university setting, in a research setting. You say, I'm here, I want to write a paper. What can I do? It doesn't work like that.
I think it's important to mention here that, not every mentor is good for every mentee, like the expectations you're talking about, they need to align with one another. So, it's important, of course, that as a student, you get appreciated for the goals and time you have and you are willing to spend on research, regardless of how much that is. But it's important that it aligns and it corresponds with what your mentor has in mind. So the gap shouldn't be that big,
That's true.
So it's okay, if you do not connect well with the mentor because your expectations are very different or your goals or the time your mentor wants you to free up for the research and you are not able to. It's okay, not every mentor is for every mentee. So I think respecting someone is important, but also making sure that you aren't too far away from one another in that relationship as a mentor and mentee.
That's really true. Yeah.
So it sounds like Dr. Kurt's worked with you on identifying what your goals are. Can you share with us what those goals are?
Yes. So, neurosurgeon might be not so surprising, but also, as I said, I did biomedical sciences before, and I got so fascinated by research, and now especially neuromodulation and neuroscience, that I would love to be a scientist in the field of neuromodulation. Also, I see myself doing that in my future career, and to be able to combine that, with the clinics, seeing patients, talking with them, communicating with them, but also doing surgery, having that practical part as well, combined with just scientifically challenging myself. I like to have a bit of both. So being able to provide the best care for my patients also means doing new research to find new strategies or to optimize existing strategies.
Right.
So for me, in an ideal world, I'd like to be, a scientist in the field of neuroscience as well as a functional neurosurgeon.
Yeah. As we could see the last days, the field is growing so rapidly. The field of neuromodulation is so interesting. New things are happening, new indications are coming, new paradigms of stimulation. It's so interesting field. And you're very young, so I think you can achieve many, many things in the field of neuroscience. So it's time to step in already now, you're a medical student, so you can be better later.
It's true. The earlier
that's how,
you start,
how I see it.
Yes,
Yeah.
I think the earlier you start, the more you learn, the more, you get formed in a way.
Yes, and the more you can motivate other people.
Yes,
Because you will have students as well, maybe in 5 years, who are doing research for you.
Maybe next year.
Maybe next year.
Who knows? Yeah.
So one thing that I'm observing here is that it sounds like sometimes with research, for example, you'll identify a topic, Dr. Kurt, and sort of charge Linda with the project, right? Would you say that in working with mentees, you then get to expand how much you learn in that you have many people researching these topics sort of on behalf of these insights or ideas that you have? Is that a benefit that you find to mentorship?
Yes, it's a benefit for a mentor. Indeed, to have that feedback from the mentee, because I learn also from them. Of course, I know many, many things in my field because it's my hobby. Neuromodulation, functional surgery, that's my hobby. I read every day, I watch videos, I listen to other people, but still, I'm learning. Even when you're getting older, you still learn new things and listen to other people. So that motivates me as well, and it keeps me sharp. Before I worked in a private hospital without students. So after 4 years, I said to myself, I should go back to the academy, to the university hospital, because I have the interaction with others, with students especially. So they can keep me sharp as a teacher, as a motivator, as a neurosurgeon. That was the reason to come back to the academy again.
Dr. Kurt, I'm curious, what advice would you give other mentors in terms of how they navigate finding mentees, how they work with mentees, and how they approach the way they show up as a mentor?
Well, my advice would be to keep the eyes open, but also stay open, because you're a professional. You're getting older as a professional, and some people change when they getting older. They are a bit more closed. But keep the eyes open to younger people, talk with them, and after you talk with them, you get in touch with them, you will see those who are dedicated and those who are not. But talk with them and try to find an interaction in which you can make together the difference. So my advice would be stay open for younger people and try to motivate them. Of course, when you've found a nice team, try to motivate them even further. Not only the contact and a goal, but stay in touch with them even later on. So don't forget to make regularly appointments with them so you can see whether they grow or not. So you can steer them to the right pathway, how to develop further in the next years. That's important too, I think. Not only find those to work together with, but also to guide them through that whole process. Because when you're young, you cannot see where the end line will be. That's very, very difficult. When I look back to myself, it sounds so easy how it would go. But I talk with other younger people also from the States and from Europe. And I know that that's an important point. When you're young, you don't see how you can develop yourself. And you need some help in the interaction between a mentor and a mentee.
One thing that's coming to mind for me is also the impact of generational differences. Sometimes I'll chat with mentors in our mentorship program about, their mentees are talking about TikTok, and the mentor is like, what is this
What
TikTok
is TikTok?
business?
I have an account.
And so what would you, and either of you can answer this, what advice would you give for being able to build a meaningful relationship where you're not necessarily in the same generation, right? And you have differences in how you approach the world or what your priorities are?
I think I'll take this one.
Okay.
I think just to be very short on that, meet one another in the middle. You should look a bit my way, like the mentor should look a bit that way to the student, but also the student should try to move a bit towards the mentor, just meet one another in the middle. I think the short answer to the question.
Listen to each other,
yes.
Respect each other.
Communicate with one another.
Yeah, and don't think I know it always better than you. Because that's, I think, a fault that mentors make. They think I'm better than you because I'm older than you. I'm longer in the field than you. Listen to them. It's very important.
But also there, as a student, of course, as a mentor, it's important to be able to, give the student some safe space so the student feels okay with sharing if he or she doesn't understand something, if something is unclear. So, yeah, I think the space should be there also.
That's important to share, that you feel comfortable.
Yeah, and also, if you don't feel comfortable with something, like whatever it is, just, that you are able to discuss it with each other.
I agree.
And I think just communication is key to reaching that middle part between different generations. I don't think it has to be that big of a problem as long as you just listen to each other and communicate.
Well said. Yeah.
Sounds like curiosity is probably central to your approach.
That's a good point too, yes. In each other, yeah.
And something that I've observed is, well, Dr. Kurt, you had said that neuromodulation is your hobby, right? Many people don't consider their work their hobby.
Really?
And in chatting with you this week at the INS Congress, Linda, you've brought up that you have so much passion for this that you actually find yourself excited to be doing research, right? It doesn't feel like work. So I'm curious, can you share a bit about how do you keep your passion alive?
I think the passion, I keep it alive by, really seeing that my work, like that I achieve things, that I make small steps, that I make progress. I think that keeps my passion alive. Like the moment that I finish writing an article and I press the button save, send it to Erkan, I get so excited. It's crazy. And the best feeling is whenever, you click the button submit, but when you're finished with the article, that's, I think, it thrives me. When I get the chance to present my research, seeing others getting motivated as well, it gives me so much energy. The way I get challenged also by my mentor, but also by other teachers, it gives me so much energy, but also I get advice on how to do things better. It keeps me sharp and it keeps me motivated, but also to hear at times when I did things well. I think a combination of that and also the interaction you give me by letting me join to meetings, to congresses, I think all of that combined together with making small steps in my career.
I need to introduce you to other people in our ward. Yeah.
And
make
also
you enthusiastic too. Interaction with other one. I'm important for you, but other people are important too.
Yes, so I got to meet at the INS like many other colleagues with refreshing insights on topic, and they teach me things that we, or at least we didn't talk about yet. So it really is refreshing to also meet others, to share that passion with, and to see passion with others who also as passionate as I am. It just gives me a boost of energy. So I think that's what keeps me going.
It keeps you alive.
Yeah, it keeps me alive, keeps me breathing. Yeah.
And Linda, you've now been to a number of conferences in the field. You mentioned EINS, which is our European chapters event, which was in Hamburg, Germany last year. We're in Vancouver, Canada right now at the 16th World Congress of the INS. I'm curious if you could share what the impact of being at events like this is, and why would you recommend that medical students start attending events like this?
So, just to start with my first, the experience at the Congress in Hamburg, so the AENS, just to all students, to everyone listening to this, yes, it's scary. You feel like a little fish in a big sea, just to state it the way it is. But, it can be uncomfortable at times. However, the more you give it a shot, the more you learn, the more you make sure you're open to meeting new people and to learning about new ideas, the more energy you get from that. So at first I was a bit, hesitant. I didn't want to make, any weird comments, because I didn't know everything. I still don't know everything in the field. So for all the students, that's okay. That's why we're students.
I give you advice. Listen, when you are new,
yes,
don't feel obliged to say something. Listen first. That is okay. You're a student. Some people feel themselves forced to talk about things that they don't know how to talk about that. So listen first. Get in touch with people. It will come later. You did that really very nicely.
Thanks.
Yeah.
So, for what I would wanted to say to other students, yes, it can be scary the first time, but it gets so much easier as long as you're open to it and you show people you're passionate. Just listen. If you do not understand something, that's okay. That's why we didn't, graduate and have all our papers, and that's totally fine. I needed to go on the stage to present my work, and I was so scared. You know why? Not because, I practiced every single word of that presentation, but I was scared because of the question. And I was very nervous, and I said to myself, you know what? This is my first ever Congress. Who cares if there is something I don't know? I'm a student, and we are here also at the EINS to learn from each other.
Right.
So to all the students, yes, it's scary, but you learn a lot. And it's okay if you don't know everything, because we're students. We are here to help each other. And also, I'd like to have more company during the coming INS congresses to make some friends, more friends. That's cool. So I think all of that, just be open to it. It's scary, but it will get better. Definitely.
So you also mentioned this sort of nervousness when you were first meeting Dr. Kurt, or when he invited you into his office to speak for the first time. Can you tell me what strategies you employ to calm your nerves in those kind of intense moments?
What did I do? Make bad jokes? Do something bad? No, it's just, I think just sitting there and just listening to him, what he is saying, rather than me talking over and over again. If you're nervous, just try to sit still and just to listen. Make sure that you hear everything what's being said. And really, when he asked me something, I sat down because I was quite nervous. I just wanted to do well. And I thought about the answers. I just give myself a minute and okay, how am I going to answer this? And then I answered. So there was space in the conversation. And also before coming to the office, I calmed myself down and I said, you know what? If I don't believe in myself, who else will? So I think that's important. Just believe in yourself and take the time to reply.
I remember that,
listen.
yeah. That's also, I think, an advice for the mentors. Show patience to your mentees. Don't expect everything very quickly. And be patient, listen to them. And truly, you did that remarkably, very nicely.
Thank you.
Yes, you wrote everything down. You thought about things, how to answer. And that's okay for me, because I have the patience to wait for you to answer things, to do things. That's important too. Patience for good mentorship.
I think patience is one of the answers to the question that I'm about to ask, but do you have any other advice for mentors around how they can build trust and a safe environment with their mentee?
Well, it seems very easy to answer that question. Very simple, very logic, because how could it be otherwise? I think the mentee should feel safe while we are listening to them, giving them a good feeling, giving a good interaction, taking time for the mentee. That's important things. And there are very simple things, but we have to do that as a mentor. We should not forget that in our mind, because we run away from the one appointment to the other, in the ward, in the hospital, from one appointment to the other. And I need to find time to give you a comfortable feeling so you can be better, you can feel safe and ask questions back. Otherwise, you will not feel safe and you will not ask me questions back. And then our relationship as a mentor-student will fail on time. That's important to mention, I think.
I think just being respectful both ways is a key here.
Yeah.
So, Linda, one thing that you had mentioned is wanting other folks, younger neuromodulators, to be joining you at these conferences so that you're able to connect with people other than just Dr. Kurt, though it sounds like you have a lot of fun together. What advice would you give to people who are interested in coming to these events, who might have questions or are looking to maybe break into this space but are nervous?
So I totally understand that, because I was nervous as well, and I'm still at times. So just feel free to contact me via LinkedIn or send me an email or even a text if you have any questions or if there's anything you're hesitant about. I'm always open to helping others to make sure I have, good company at the next congresses. just feel free. My door is always open for anyone who wants to ask me anything about, just random things or mentee-mentor things. It's always good.
We'll be sure to put your LinkedIn profile in the show notes so folks can reach out to you there.
Thanks. Great.
So to close the show, I'm curious, looking to the future, what are some of the innovations on the horizon in neuromodulation that you're most excited about, or that you two might work together and do research around?
Well, I think I can mention two things. The first one is the neuromodulation of the spinal cord for movement, for motion. Of course, there's a very nice project ongoing in Lausanne. We are working together with them in a very nice study, Hemel study at the moment. I think that's one of the points that are very interesting for the future. And the second thing is the destructive surgery done by neurosurgeons, like the cingulotomy or other procedures within the central nervous system. Where neuromodulation doesn't work, we should look further for other options. And then we come into the field of the destructive procedures. That's interesting me, really.
Fascinating.
Yeah.
And Linda, we were talking just the other day about this procedure. Can you explain what a cingulotomy is?
Yes, so just also for the students listening, maybe I'll make it easy. So you have like this central structure in the brain, which is called the cingulum. And it appears to be very important in, for example, emotional processing. So the way you experience pain. So you can have pain, but you can be depressed because you have pain. But you can also, still be able to do your daily things because you're in pain. And that's the cingulum. It really affects the way you deal with pain. So what cingulotomy does, you kind of bring in a tasker, and correct me, surgeon, if I am mistaken anywhere. So you bring in a tasker on the central structure, cingulum, in order to kind of destruct the fiber connections going through this structure, which is connected to various cortical and subcortical areas, all involved in emotions, to make sure that, you could potentially adjust the way someone deals with pain. So meaning that someone can still have pain, but is no longer bothered by it.
So the emotional processing of pain.
Yes, exactly.
And this procedure is relatively new to my understanding. When you say the cingulum, is this like the anterior cingulate cortex or the ACC?
Yes, that's where the cingulotomy is mostly performed. So you have different parts of the cingulum. So you have the anterior part, the middle part, and the last part, the posterior part. And it's mostly on the anterior part, so the frontal part, it's like this, where the cingulotomy is performed.
Okay.
So the ACC.
What was some of the results that you found in the paper that you produced?
So that's actually an incredible story. It is a woman that we performed, or I didn't do anything. He performed the cingulotomy on. And what happened is, after a few months, because she had euthanasia approved, it was a woman with central post-stroke pain. She didn't want to continue her life anymore. Euthanasia was approved, so she was very depressed. She came to the clinic. Cingulotomy was performed. What happened then, within a few months, 2 or 3 months, she said, first she regretted having the surgery because she didn't experience any changes. And after, I think, 3 months, she said, I still feel pain, but I'm no longer bothered by it. And that's the cingulum, so the emotional processing. However, I don't know if it was surprising for you, but to my surprise, a few months afterwards, the pain had completely disappeared. And the lady is now pain-free, like it has been 3 years. And she's pain-free till this day. She regrets ever asking for euthanasia. So I think that's a beautiful result
Story,
to share here. Of course, results can be different between patients, but this is a very nice story.
Project started very recently, so we have to gain more experience in that field to do a study on that.
But fascinating to learn about the start of this procedure. And then, Linda, did you want to share about any innovations or particular topics in the field of neuromodulation that you're most excited to explore in the coming years?
What am I most excited about? There are so many things I would like to learn about. Where should I start? Yeah, I think what we are recently have been discovering is the phenomenon of voltage tuning in occipital nerve stimulation, which is when, patients will be given a remote control, allowing them to adjust the amplitude whenever they feel a cluster headache attack might be coming. And ONS, so occipital nerve stimulation, what Erkan already, explained you a bit about, has proven to be effective as, a maintenance therapy. But voltage tuning, so adjusting the amplitude manually, like we are now recently thinking that it might also be effective to, as an acute attack treatment, that it could cease or prevent additional cluster headache attacks from occurring. So we now wrote the first paper describing the presence of this phenomenon, and I would like to discover this more. So what's the best amplitude? What's the best, duration, the best moment of this voltage tuning? So that's
why
interesting.
People are doing this.
Yes, exactly.
Normally they take a sumatriptan injection or oxygen therapy, and now they take the remote control to win the fight with the devil in their head. That's what they tell us. So very interesting, this phenomenon.
Fascinating.
Yeah.
So it's just the cingulum, since it's quite new, the cingulotomy part, but also this whole voltage tuning phenomenon that I would like to, to get myself into.
Brilliant. Well, thank you for sharing. And I want to just thank you both so much for being on the show. This has been really eye-opening, and I hope it creates opportunities for mentors and mentees to better facilitate the relationship that they have.
Thank you so much for having us
Thank you for having us.
Really.
It has been,
Thanks so much.
Great meeting you and great being on this podcast. Yeah. Thank you.
And Dr. Kurt, thank you for facilitating such opportunity for young neuromodulators. We really appreciate the contribution you also offer to the field in that way.
Thank you so much.